Welcome to this comprehensive overview of compounding and stability in pharmacy practice. This presentation will cover key aspects of sterile and non-sterile compounding, aseptic techniques, stability and compatibility of medications, storage and disposal practices, quality control measures, USP standards, and special considerations for different patient populations. Sterile compounding involves preparing medications in an environment free from microbial and particulate contamination. It is critical for medications administered via injection, infusion, or other sterile routes to protect patient safety. Customized dosage forms, addressing drug shortages, and preparing specialized clinical medications are some of its applications. Aseptic techniques protect sterile products from contamination, including hand hygiene and PPE use. Sterile compounding occurs in clean rooms meeting specific ISO classifications to ensure minimal airborne particles. Continuous or periodic monitoring of surfaces, air, and personnel is essential to detect and mitigate contamination risks. Sterile compounding environments are classified into ISO Class 5, 7, and 8. Class 5 environments have the fewest particles per cubic meter, followed by Class 7 and Class 8. Each class has specific requirements to maintain the sterility of compounded medications. Laminar airflow workbenches provide a constant flow of HEPA-filtered air. Biological safety cabinets protect both the operator and the environment. Compounding aseptic isolators are enclosed spaces using glove ports to maintain a sterile environment, typically for non-hazardous preparations. Personal protective equipment is crucial for sterile compounding. Gowns prevent contamination from splashes, gloves are recommended for hazardous drugs, masks and respirators filter airborne particles, and face shields provide additional eye protection. Proper hand hygiene involves washing hands with antimicrobial soap for at least 20 seconds and using nail picks. PPE and gowning include wearing sterile gloves and disinfecting them with 70% IPA. Proper work techniques minimize talking and unnecessary movement within the sterile area. Preparation involves gathering materials, environmental cleaning, compounding processes, and inspections. Verify drug vials, clean surfaces with 70% IPA, withdraw the drug using a sterile syringe, and check for particulate matter and clarity before storing under recommended conditions. Labeling requirements include drug name, strength, route of administration, and beyond use date. Documentation involves maintaining a compounding record, quality control tests, and accountability through second checks or pharmacist verification for high-risk preparations. Quality control includes environmental monitoring, personnel qualifications, sterility testing, and adherence to USP. Regular audits and documentation ensure compliance with cleanroom standards and aseptic techniques. Common errors include labeling errors, aseptic technique lapses, calculation mistakes, and high alert medication handling. Prevention strategies involve double-checking labels, retraining on aseptic techniques, using standardized concentrations, and independent double checks. Non-sterile compounding includes creating creams, ointments, capsules, and oral solutions where sterility is not required. USP provides guidelines on practices to ensure the safety and quality of non-sterile products, including personalized therapy and tailored medications. Tools for non-sterile compounding include mortar and pestle for various drug consistencies, electronic balances for precise measurements, blenders and mixers for consistent particle distribution, and capsule filling equipment for manual or automated filling of capsules. Basic techniques include weighing and measuring, trituration to reduce particle size, geometric dilution for mixing potent drugs, and levigation to reduce particle size in suspensions. These techniques ensure accuracy and consistency in non-sterile preparations. Key ingredients include emollients, humectants, adsorbents, anti-foaming agents, and emulsifiers. Special considerations involve avoiding certain excipients for specific populations, such as alcohol in pediatric syrups and lactose for lactose-intolerant patients. Labeling requirements include patient name, medication name, strength, dosage form, and beyond use date. Documentation involves a master formulation record, compounding record, and batch-specific details, including lot numbers and QA checks. Safety and hygiene practices include using personal protective equipment, maintaining hand hygiene, sanitizing work surfaces with 70% IPA, and ensuring proper ventilation to reduce airborne contaminants. Quality assurance involves standard operating procedures, in-process controls, finished product testing, and documentation. These measures ensure uniformity, appearance, and pH of compounded products, along with keeping logs of all QA/QC activities. Stability refers to a medication's ability to maintain its properties throughout storage and usage. Compatibility involves mixing substances without causing undesirable reactions such as precipitation or inactivation. Factors affecting stability include temperature, humidity, light exposure, and pH levels. Excess heat, moisture, UV radiation, and extreme pH conditions can degrade medications, affecting their efficacy and safety. Understanding the common incompatibilities in medication mixtures is crucial for patient safety. Physical incompatibilities can result in precipitation or crystallization, while chemical incompatibilities may cause reactions that degrade active compounds. Therapeutic incompatibilities can alter clinical outcomes, such as antagonistic or synergistic effects. To ensure medication stability, follow storage instructions, use appropriate containers, perform stability assays, and conduct compatibility checks. These guidelines help maintain the efficacy and safety of medications. Proper storage and disposal of compounded drugs are essential. Store under recommended conditions, protect from light, and control humidity. Follow disposal guidelines to handle hazardous waste safely and participate in take-back programs. USP standards provide a framework for compounding practices. USP covers non-sterile compounding, USP focuses on sterile compounding, and USP addresses handling hazardous drugs. Compliance ensures safety and regulatory adherence. Implementing USP standards in pharmacy practice involves developing SOPs, training staff, performing environmental monitoring, documenting activities, and conducting audits. These steps help maintain high standards and ensure compliance. Compounding for special populations requires considering unique needs. Pediatric, geriatric, pregnant, and immunocompromised patients each have specific considerations to ensure safe and effective treatment. Assessing patient needs for special populations involves reviewing medical history, laboratory data, treatment goals, and providing patient counseling. This comprehensive approach ensures personalized and effective care. Selecting appropriate ingredients for special populations includes avoiding allergens, using alternative sweeteners, flavoring agents, and appropriate bases. These choices help tailor medications to individual patient needs. Effective patient counseling for special populations involves using clear communication strategies and addressing key counseling points. This ensures patients understand their treatment and can manage their conditions effectively. Mastering compounding and stability is essential for pharmacy practice. Key takeaways include prioritizing patient safety, continuous learning, and a patient-centric approach. These principles help pharmacists provide the best care.